Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome to another episode. Today I'm with Dr. Vic Martel. He is a prosthodontist practicing in West Palm Beach, Florida. Vic, thank you so much for joining us today.
Glad to be here. I really appreciate it.
Yes, done some episodes with you in the past, and you're a great listener as well because you're always giving me good feedback and suggestions for new topics. I love people like you. It's really helpful.
You've had some great guests. I mean, even those two young surgeons you just had on the last episode from, can't remember where they were from, but excellent. Those two young guys, then they have a group practice.
Yeah.
It's amazing how, and being from my side, the restorative side, how what you guys do still interests me. And maybe it's because I work with a lot of surgeons around the country. But I really enjoy it. And I haven't seen anything as big as yours from an oral surgery standpoint. So that's great.
Yeah, it's super fun. Very educational for myself and hopefully for our listeners. So recently we've been doing some episodes with Roger Levin and others kind of on the marketing slash dealing with your referral, type focus. And we thought it would be a good one to do an episode with you more from the GP standpoint, because all the episodes we've done with Roger have been from the specialist standpoint, looking toward the GP.
Yeah, those have been very interesting, and it gets my mind working because I want to correct one little thing you said. I'm a GP. Now my practice was geared towards prosthodontist, but that even gives me more weight here. What we're going to talk about today, because I practiced general dentistry for 36 years, long time. But as the practice evolved, it was purely, if you were to walk into my practice, it would look like a prosthodontist office to you. It was one of those types of things. But it's been, what's really worked out well for me is the situation where, because, we talked about my programs that I do, I think it was August of last year, where I come into a surgeon's practice around the country, and we have, the whole basis of what I call my CERT programs is educating my surgeons that bring me in, their referral bases, so that the referrals, the GPs, become better adept at doing dental implants and communicating implants and treatment planning implants. And in turn, what that does for the surgeons is it builds their practices, because their referrals greatly increase, because we're just opening up the eyes of the GP to things that are probably already in their office that they just don't see. And that's the reality of it. And through that, because I've gotten the opportunity to meet, at this point, I've been doing this 15 years of my career, probably hundreds of surgeons, hundreds and if not thousands of GPs. I already know the GP side fairly well, but meeting and talking to a lot of them really, really helps, because I listen to their mindset. And the good news is, because I have dinner with probably every surgeon I ever work with multiple times, because my programs usually go over 6 months, 9 months of multiple sessions, I really hear the inside scoop of the GP, of the oral surgeons, and what they'd like to achieve, and where they want to grow with their practices, and how they relate maybe to their GPs and things. And listening to Roger, I listen and I'm going, wow, all those things are right on point. And I'm thinking, do these surgeons, when they do these things that Roger's espousing, which I think are great, do they really understand how the GP's thinking through this process when they get approached by X, Y, or Z, and what they're doing to bring these GPs into their fold and make them feel like they're a part of the practice, which is ultimately really, really important for these guys. So that's where these questions came up with in my mind that I hear constantly and all the time. And once the oral surgeons really understand the mindsets of their GPs, because you're never going to think the same way. We practice significantly different, right? You're in a surgery practice. We're one of these fortunate or unfortunate types of professions, the GP, that we can do anything. We're legally allowed to do any procedure we want to do. And that could be a blessing or a curse. It really could. And, me, in my life, I really funneled down my practice to the things that I really, really enjoyed doing, and therefore studied tremendously and got very adept and good at those. But I really, I always say to my attendees, my practice was more like a triage. You needed wisdom teeth, go see Grant. You need this, go see this person. You need implants, go see his. And I basically did what I did really well, but I didn't stay in that, for lack of a better way of saying it, jack of all trades. And because it just was never my philosophy that if I wasn't really good at it, I'd rather send you to somebody that's better at it than me. I had plenty of patients ask me to take their wisdom teeth out, and I would chuckle and I go, you don't want me doing that. That's not something that, I'll be here 2 hours doing it, and Grant will take them out in 15 minutes. Just go over there. And I think that mindset becomes important, because at some point, and this is difficult for GPs, and this is where we're going, is at some point, it can't be about the production. It's very difficult. And I understand it completely, because, these poor guys and girls are coming out of dentistry, dental school, owing $300,000, $400,000, $500,000, if not more. And I have to say, I don't know if I had that type of debt if I wouldn't try to do more procedures than I did, because my life led to, for me, listen, go see Grant. I don't care about your $2,000 for your wisdom teeth. You're going to get a better experience over there. Go that. And that kept me very focused on what I liked. But I don't know if that's, it's the more and more dentists I speak to around the country. I was just in Columbus, Ohio last week. I get it. And I think there's this percentage of the GP population that really just wants to do, this little narrow focus and get really good at it. And then there's other it's completely understandable that they feel like they need to do everything. And that's where the relationship with the surgeon becomes more important, because we need to not necessarily change that, but make it a better relationship so that they feel like, here's the thing that we're going to talk about. A GP needs to feel like this relationship between their surgeon and you is mutually beneficial. And what I mean by that is not just, Grant, that you're treating my patients well, that's a given. Two things that have to be for every GP is, I have to send it to somebody that I know is very good at it. I have to send it to somebody that's going to treat my patients a certain way. Those are given. Okay. So those aren't anything special nowadays. But what is special is the surgeons. I have to feel like the surgeons are investing in me and helping me grow my practice, because I'm kidding, but it's not kidding. The average GP thinks, I'm making you rich, Grant, and I'm not getting anything from it. You're doing all these wisdom teeth all day, and it's a low overhead thing. You're making all this money, and what am I getting out of it financially? Believe it or not, that's where things have to be. Time and money on a specialist side to invest in these dentists, so that they feel like they're growing their practices along with you as a partner in some form. And that's where my programs kind of, that's where my programs led, is that mutually investing in Grant helping these GPs get more cases, recognize more cases, do more cases, so that they feel like they need you. That's really important. They have to feel like, my goodness, if I don't send a Grant, I might not be invited to the next CE that he does that helped me grow my practice last year by 20. And those are the things that, because on the other hand, I did this long enough where the specialty field was just like, here's the oral surgeon in town. He's the best guy. Just send it there. Don't worry if you get anything back. Those days are over. And the GPs are rising up in the sense where they really need to feel like, financially even, they're benefiting from knowing you as the oral surgeon. So this is where all these questions might pop up today, but I'll let you ask some questions and we can go from there.
I mean, that brings up a lot of great points and questions here. What have you found to be the best way for general dentists to feel like they are being invested in? I mean,
obviously the best one, obviously, and so we talk about, like even Roger talks about, we talk about CE and doing continuing education, and in and of itself, CE is great. Are you giving the type of CE? And this is, sounds like a cliche statement. Are you giving the type of CE, or is your speaker the type of speaker that they can take some of these things and bring it to their office on Monday and use it and do things with it, as opposed to, there's a difference between, I've always said this, there's podium speakers, right? There's educators, and then there's one in between. I call it edutainment. Are they educating you in a way that you want to stay engaged with your speaker. And also, let me show you how to do some procedures that are going to increase your case acceptance in your office, whether it be verbal skills, whether it be, let me show you what's in your hygiene that you're not seeing. So, just education in and of itself is less important than the quality of the education and how does it get butts in the chair and procedures for them to do that are within their skill sets and scope of treatment. And that's really, really important because you want them to recognize that, subliminally even, you want them to recognize that Grant Stucki is going to do a better job taking some wisdom teeth out than they are. However that education goes. It's not just, let me teach your GPs, let's have a course on CPR. Okay, perfect one that a lot of surgeons do. CPR is great. The ultimate way of bringing a referral in is by partnering with them, whether it's through verbal skills at first and whatever. And how do you partner with your GPs in a way that they know that you care about as much about their practice as they do? And that's not an easy thing, but it can be done. And I think once they really have that relationship with you, I think they become very loyal because you're different than everybody else, every other oral surgeon down the road. You're the guy, and we know some surgeons in common. And I always say this, I want Grant Stucki to be the guy in your area that everybody looks to and says, Grant holds this education and it's always growing my practice. I love going to his stuff, as opposed to, and you know this as well as I do, a lot of GPs go to CEs in the evening for the free meal and the CE. They don't really care what the CE is, right? Now, that's okay, but is there any ROI on it? Most likely not. On both sides. You're probably not getting much, and they're certainly not getting anything to help their practice. So think very carefully about the type of education, and always ask this before you have a course. Is it going to help them contribute to the growth of their practice? If it does that, you're on the right track. So that's the most important thing.
Talked about this a little bit with Roger, but we know there's a lot of general dentists, GPs refer to multiple different, let's say, oral surgeons, and oftentimes that's frustrating, for the specialists. They're like, why don't you just stick to one person? Can you explain a little bit about the mindset there? Like, why would a GP refer to multiple people?
And I can, and the reason is that I probably did that, and what I always say this when I speak, I said, listen, I'm not going to tell you anything that I didn't do. Okay. Meaning I've done every mistake that they've probably done. And that's okay because I learned from that. But I think the mindset, Grant, is this. Let me give an example. Well, when I'm speaking in a group and let's say I'm in Denver or wherever I happen to be, and I'm talking about this topic, the first thing I say to them, and I can say this to them and maybe Grant Stucki can't, I literally go up there and I say, listen, understand this. When you refer to an oral surgeon or a specialist, please don't give them 3 cards. And here's the reason. A patient wants to feel like you're confident and that you know where you're going and you know what you're doing. And in essence, what you're really doing is, and I've had run-ins with patients about this. I would say, for example, okay, we're going to set you an appointment up, and we'll talk about that in a second, where you're going to go see Dr. Stucki, and he's going to do this for you, okay? And they'll say to me, and I had a patient do this to me one time. I'll say, I think she called me up the next day, the patient, and said, listen, my neighbor's an oral surgeon, and he wants to do this for me, and he said he would do it for less. And I said to the patient, that's not a problem. I'm sure he'll be glad to send you to a restorative dentist that'll do the work. And she was kind of taken back a little bit. And she says, why? Is there something wrong with the surgeon? I said, absolutely not. I just don't know the surgeon. I don't know his protocols. I have a surgeon that I work together. We know we work very successfully together. And I need that type of system in my office. So if you want to go someplace else, that's up to you. But I'm sure he'll send you another general dentist that'll finish the work for you. And within 5 minutes, she says, okay, I'll go to your doctor. That takes a little step of confidence on the GP side. And the reason is that, and I'll fully admit that not a lot of GPs, number one, like any confrontation. They don't like that, any kind of resistance. They don't want to make confident statements to people. So, and in fact, handing 3 cards sometimes, and mostly they hand them 3 cards for one main reason is this. And this one drives me crazy. Where do you live? I live North Denver, South Denver, East Denver. In my hands, and I don't mean to sound harsh. I don't care where you live. Okay. It's another 10-minute drive. I want you to go to who's going to do the best work for you. And ultimately, location isn't how I pick my surgeons. It's by my how I work with that person. And ultimately, they need to get to the point where they understand that you have a relationship with them that they would say, and I had a patient say to me one time, listen, I have to drive 35 minutes to your surgeon, and this guy's only 10 minutes away. And I go, you know what? You're only going to be there a couple times. Trust me, you're going to get a great job. Just go there. But that takes a little bit of confidence and kind of like, just, for example, if you had a physician and they were sending you to a certain cardiologist, you're not going to go, would you have anybody that's closer? It's just, That's not the kind of relationship you have. And they have to build that trust with their patients. I think it's just lack of confidence on their case. And you know this as well as I do. A lot of GPs, they really want to please people. They're good people. They want to do things, but they don't want to step on anybody's toes. So they tend to do that. I don't do that. And even in the sense where they might say to you, and I heard Roger talk about this, well, maybe they rotate surgeons. Maybe they'll send it to Grant one time and Mike the other time and Joe the other time. I don't get that. And the reason is I think they want to rotate because they don't have a strong enough relationship with one. I was at a point where I was probably loyal to a fault. I used the same oral surgeon for 20 years, same endodontist for 25 years, same orthodontist for 15 years, because I knew I got the results I needed. And that's all that mattered to me, other than having a really good, close relationship with them. There's a lot of trust and consistency in work. And that's where you have to be a little different than everybody else. Trust me, if you did a ton of education in the area and you were the only guy that's known for that, I guarantee you that rotation would probably become less. But everybody's a little different in that sense.
Okay. Yeah, I mean, it seems like there could be multiple variables, like even from, let's say you refer to a surgeon and then you get multiple patients calling back saying, oh, they don't accept my insurance, or there's some financial problem there. They're too expensive. They're this or that. Or it seems like that could be something. Maybe you're a dentist and you're getting all these gift baskets from different surgeons, and you kind of feel bad not sending stuff because this guy keeps giving you stuff. I don't know if that plays into it.
I think the insurance could. I never had a practice that was heavy insurance at all. I just had a few indemnity insurances, and that was about it. So I never thought about that process. But I will tell you this, be really honest with you. I had 2 endodontists in town that I sent to, and there's 2 separate practices. The one I'd used for 30 years didn't take any insurance at all and was just, a cash basis. And, I still talk to him to this day. Now, the other guy, I had to develop a relationship over time, but I knew he was very good. I knew he did great work. He was very, accommodating for my patients, and he did take some insurances. So that was the only instance where if somebody said to me, well, Dr. So-and-so, I don't think he takes insurance, or if I happen to know that already about the patient, then I would send him to the other person. But there was only 2. It was never, here's 3 cards. And that was the only instance. With oral surgery, I never had that issue. With perio, I never had that issue. With endo, it probably maybe popped up. And I hear that insurances are becoming more, depending on where you're at. Like when I'm in Minneapolis speaking, it's a heavy insurance area, and I get it. But ultimately, you have to be there for those types of patients and GPs, in the sense where maybe you take a few of the insurances. I don't know that. That's part of the game I didn't really understand very well. But and gifting's we can talk about that in a second. But
okay, another question. We've kind of discussed a little bit with Roger about the importance of communication and having like a PRC is who he calls it, that communicates. But I mean, how often do you think a general dentist wants communication? Is it as much as Roger says? Is it less? What are your thoughts on that one?
No, that's a great question, because when Roger talked about it, I had a few differing thoughts, but here's my opinion of it. Here's my pet peeve, first of all, which is about communication, but from a different standpoint. And I had my periodontist was like this. If I called you up to speak to you about a case, and I said, even with me, and I was a pretty heavy referral. I probably referred by myself a couple hundred implants a year, maybe a little bit more than that. So I knew that I was a good referral. And if I called Grant up and said, can Grant get back to me by the end of the day? I expect a call. Okay.
Yeah.
I had one of my surgeons that sometimes wouldn't call me for 3-4 days. Okay.
Oh, wow.
That's the problem. Okay. Now because of my, maybe to a fault loyalty, and I would have the conversations. I would say, listen, I need you to get back to me sooner. But I will tell you this, with that little bit of behavior that I didn't really enjoy, if somebody knew would have came into town, would have been just as good, would have been really good communicator, I would have left the surgeon because of that thing that's so important. If I'm thinking about a case, it's on my mind now. It's not on my mind in 2 days. So if I'm an A referral and you're not in surgery, come to the phone. Okay. On the other hand, I understand you have a busy day, but at minimum by the end of the day or something, I need a conversation, because that's when it's really, in front of mind with me. So that part of communication has to be done same day. Do you need to stay in contact with your A referrals? I think Roger said every couple of weeks or something like that. For me, here's the difference with the way an A thinks. I appreciate our relationship. I'm not heavily dependent on you to help me treatment plan a case a lot of times. So I don't ask a lot of my surgeon, meaning if I got the case figured out, I send it to you, we're good. I don't need another 40-minute phone call. Okay. But on the other hand, and the reason I say that is when I call, because I don't expect, that constant communication. If I do call, you should know that it's important, because I don't call that often. Okay. So then definitely get back to me. I think the B's probably require more attention. I think because they're not quite there as far as maybe knowledge, or maybe they don't see you as much because your A's are getting sending more referrals. If I was going to say something, I'd say get more in contact with your B's every couple of weeks, and just, make sure you're at least speaking to your A's, whether it's just a quick text or, hey, how you doing? Or you want to go to dinner and things like that. Because I think they really need to feel appreciated, but they're probably a little bit more independent than you think. B's aren't, C's are definitely not, but I'm not sure about the C's as far as how often you communicate with them. So, but what Roger says is so true. You always want to strive to make, and this is part of my program, which is basically what we're trying to talk about here. I would like to make your C's into B's and your B's into A's, and you're constantly trying to matriculate your people through the A, B, C, D, A concept, so that they become better and better and better referrals. And with that becomes more and more communication. It's a very important thing. Do I need to see Grant Stucki every couple of weeks for lunch because I'm an A? No, I don't need to do that. I'm good. Now let's talk about lunch. Let me give you an example. Yeah. One of my endodontists who I loved, he thought he had to have lunch with me every 2 weeks. And I'm, as a busy GP had a pretty successful practice, I would go just because, he's my friend and I felt good about it. But I noticed at one point that it was always small talk. It was always, hey, how the kids? What have you been doing? Where are you going on vacation this year? So after I was walking back to my practice one day, or driving back to my practice one day, and I go, man, I'm really not accomplishing much with these lunches. So the next time we went for lunch, I looked at him and I go, Joe, let's say it's Joe. I said, Joe, let me ask you something. I go, when we go to lunch, we spend about a good hour here, right? And I go, yeah. He goes, yeah. I said, what I'd really prefer is let's have our small talk, but then why don't you just ask me some questions and let's talk about our practices? Meaning, Grant, you could say to me, Vic, is there anything we need to do differently? Have you ever had any issues lately? In other words, let's get a little bit of business done during that lunch, because as well as I do, the average GP is either too shy or doesn't have the time to pick up the phone if they have an issue. They're just not going to do it. They're not going to say, Grant, I had a talk with your front desk and she really didn't make me feel like whatever. They're not going to say it, okay? They might say it at lunch if you bring up the question. So make sure part of your lunch is getting things off your chest, or let them get off your chest. And then secondly, this is really important if you're going to have a lunch. If I were you and I was going to have a lunch, if I was a specialist and I was going to have a lunch with one of my GPs, before lunch, maybe that day, maybe the day before, I would always tell any surgeon to keep track of your referrals patterns of one person or one practice. I would go on and look up how they're doing that year, meaning how many implants they referred to you, how many wisdom teeth they referred to you. And this sounds like a first time, maybe an uncomfortable question, but it's a really important one. I would want you to say to me, hey, Vic, it looks like your wisdom teeth referrals are down. Is there anything we can do to help you? Simple, right? Looks like your implants are down. Is there anything we can do? In other words, they really want to know that you care at the level where you want to help them, because it's always about what's in it for them, right? It's always what's in it for them, what's in it for them. So you can put that question at a point where, listen, how's business? I just, I looked over our numbers together, our numbers, right? I looked over our numbers and we noticed that you're a little down on your implants. Is there anything we can do to help that? Do you need anything from us? Then their eyes are going to open up and go, wow. Number one, they're impressed that and number two, they're impressed by the question of, what can I do to help you? You become more of a partner again. So those are really important aspects that I would expect. In other words, get some business done while you're enjoying a lunch so that it helps them grow your practice. Always be thinking throughout the entire process is, how am I going to help them grow? How am I going to help them grow? Instead of, what a normal specialist would do, which is normal, is they haven't been sending me as much. What's going on? So you can flip it and go, what's going on, so that maybe we need to help them grow more so that we get more referrals. So it becomes this indirect type of question.
I like that a lot. I like that aspect of bringing the business in there, but pitching it from their point of view, and how can we support you in your practice?
That's a perfect way of putting it. Yeah. Because you never know. They might have a conversation with maybe your front desk had a bad day. Something simple that's to you and me meaningless, but to them, it really triggered something. And when a GP gets triggered, the first thing you're going to notice is the referrals are going to drop for a little bit. And it may be temporary, but it's going to be there. And they may not even realize it. They may give another card like we were talking about before, right?
Yeah. And I also love the timing on the communication that you're bringing out, because I think there's a lot of GPs who will reach out and say, I want to talk about this case, or, well, review a certain incident we had. And a lot of them won't put a timestamp on it. They won't say, like, can you get back to me today? And so oftentimes I think we say we'll get to it, but I think, like you're saying, most of them want to talk about this like now, like today, in the next few hours. This is an important thing. And sometimes we don't really appreciate like how maybe stressful a certain case is, and they really want to get this solved soon. For example, like the other day I had a guy referral text me, and he texts me, a picture, and he's scrolling through a CBCT. Hey, what do you think about this tooth? Does it look cracked? Does it look infected? What do you think we should do with it? I'm thinking extract or endo. I'm not entirely sure. And the patient's in the chair, and he's basically saying, I want to talk to you like right now. I want to get the message to the patient. And I've learned that when I get text from him and others, I kind of need to drop what I'm doing and get back to him like within a few minutes. And when I do that, everything's good, right? With us, if I'm just delaying text, even for a few hours, sometimes I can tell it creates issues.
Great. And this is something that I thought was really impressive. It was Tom's idea, it wasn't mine, but a lot of the surgery practices I spoke for that started utilizing it. They actually had within their office, which is exactly what you're saying. But they would give what does Roger call the implant treatment coordinators? A PRC, is that what he calls them?
Yeah.
Okay. The PRCs would have what we call a hotline. So what do I mean by that? Your PRCs would carry a separate cell phone number and phone in their pocket the entire day. And that would only be access to your really good referrals and things. In other words, they get access to this person, whoever it is. Let's say it's Kathy or whoever it happens to be. But Kathy would know that the only time that phone is ever used is when it's super important. And if Kathy got a text saying, I need to speak to Grant within the next hour, boom, it happens. See, the thing is, if I'm busy and I have really something I need to talk to you about, the last thing I want to do is go through your front desk. Hi, this is Dr. Martel. Well, let me go check if he's busy. Let me go see if he's in the middle of surgery. And then I'm sitting there waiting, right? And it's obviously it's only when it's a super important thing. But the PRC hotline has become this very valuable thing because and you tell your referrals, listen, only use this when it's super important. But boom, and nowadays cell phones are so cheap, you keep it in your pocket. All of a sudden, Kathy or whoever it is gets a little text, and you know that maybe when you're done with that surgery, go call, because that's the way things are, where the person feels more valuable, right? Because it's something that let me give you an analogy. You probably don't know this consultant. He was probably before Roger. His name's Bill Blatchford, and he's consulted in dentistry for a long time. He gave me this one example that I thought was brilliant. He says, what do you know about a guy when he walks into Nordstrom's and he walking in the men's suit department? What do you know about him? He's looking for a suit, because men don't go casually shopping, right? Well, when a GP calls you and really has a patient in the chair, or he's talking about a case, he wants to talk about it, or she talk about it now. Okay, that may not be convenient, but at minimum, they should say, your team should say, can he call you back at 2:30 when they know your schedule? And then, of course, that phone call has to be done. Right? There's another pet peeve of mine and other people is, don't tell me you're going to call at 3 and then you call me at 4. That doesn't work. Okay. It might work once, but in the long run, it makes me feel less important, because something else. Now, if you had an emergency, that's fine, but it's got to be something that you address when in their minds it's important. It may not be that important, but to them it is at that point. So
yeah. Another question is, how important are team kind of training of the staff of the GP? How important is that if a specialist were to set that up?
Yeah, I think the twofold. Number one, what it does, and I think Roger alluded to this in a different way, is, well, let me give you an example. Here's the biggest, and I'm saying this as a GP, and me at fault as well. I could take a course on a Friday, and I would go to my office on Monday, and my whole team's there. And the first thing maybe some of the team, knowing I was at the course, would say to me is, how was your program? And the average GP in the United States is going to go like this. It was okay. That's as much information as they're going to get. Okay. So now, years ago for me, because I learned a lot from consultants, I would actually have lunch and learns with my staff because I wanted to teach them what I've learned, because it brings more passion. But in your case, as a specialist, what you want to do, or at minimum to your front desk, certainly, and to your hygienist, is you want to stand out as, for example, when a patient asks your hygienist, their hygienist, who would you go to? I would want them to say, well, if it was me, I go to Dr. Stucki. So how do you do that? You do that by standing out way more than everybody else. And what do I mean by that? If you're going to do a lunch and learn for the team, it should be something, again, that brings ROI to their office. Okay. It doesn't just entertain. Number two, if you have the ability, hygienists love CE. So maybe you give them an hour of CE. Right? That's number two. And now I'm thinking like a GP again. Here's one of the things that GPs think. You do a lunch and learn for their office. Here's what the GP's thinking. Oh my gosh, do I have to pay them for the time and they're off through lunch because now they're learning? And in my hands, I go, yeah, pay them. But you know how that is. It's this, do I send them to education and then do I pay them their salaries and things like that? So sometimes it can get a little sticky, just something simple as that. But what I want is, for example, if you're going to do for a hygienist, what I would tell you to do, don't do CPR for a hygienist. Teach them how to recognize cases of that might need implants in the future, because ultimately that's going back to the GP, right? It's going back to the restorative, how to recognize dentistry in their office. Dentists would love that because, they go in and out of hygiene and they're in there quick, out of there quick. And I try to explain to GPs all the time, 70% of your production comes out of hygiene. If you train your hygienist properly, all you're going to do is go into the hygiene room, bless the work, and get it scheduled up front. That's what you want to do, but not enough dentists help educate their hygienists to recognize dentistry. Obviously they can't diagnose it, but they can recognize it and bring it to the GP's attention so that it gets more scheduled, bringing more production out of hygiene, and therefore and if you're doing that and nobody else in town is doing that, that's a really big deal.
Very nice. You mentioned CE, getting a good ROI. Are you probing the dentist and saying what kind of CE do you want? What do you want to learn? How are you figuring out what the best CE is?
Yeah, that's an excellent way of doing it. If you have a PRC in your in your office, and if you're going to Dr. Martel's office, I would send them a little, when you're dropping off some, whatever, donuts, whatever you happen to do, which, by the way, the GPs never get to eat, because by the time the GP gets to it, the team members have already eaten it all. And half the time, they don't know where it came from, right? Because half the time, the card either never gets open or it gets trashed. So ultimately, but if you're going to drop off some donuts, drop off a little survey. And it's just as important for the GP to fill it out as it is for the team to fill it out, because what you want to know is exactly what you just said. That's a brilliant question. What would you like to learn about? What do you think would contribute to your office production if you learned it? And then you gear it towards that, because now you're doing something. Because here's the thing. If Grant Stucki does CE and the GP looks at it and goes, it's not something I'm interested in, they won't come. And then you just, right. I know your education is expensive, so you don't want to waste money and there's no ROI on it. From a specialist standpoint, I would always say to you, same thing I would tell a GP, always gear your CE to create an ROI. If you're not doing that, you can go ahead and do your CPR and stuff as a service. It's a great thing, but not something that you're going to expect a good referral pattern from. It just doesn't work that way.
Another question is, is gifting important to the GP?
That's a big question. Let's talk a little bit. I'm going to give you a really horrible example story. Number one, First of all, let me make a recommendation. If you don't know this book on Amazon, it has nothing to do with dentistry. It's called Giftology. I can't remember the guy's name. Ron something. Giftology. You can find it on Amazon, paperback. It's all about how you gift in business. Right? Number one, every surgeon knows you have A, B, C, D referrals, correct? You also know that you should know, if you have an A referral, most likely, let's just throw some numbers out there. If I'm an A referral, I'm realistically, and this is probably being very conservative, I'm probably sending you a couple $100,000 a year, maybe more. Okay. If you're a B, it could be that's not to say that I'm basing your entire referral relationship on money, but it's part of it. And everybody needs to come to the realization of that. But so for gifting, if I was a surgeon and if I knew Dr. Martel sent me $500,000 a year in production, do you honestly think I should go buy him a can of peanuts at Costco? I mean, it's just silly, right? I would say to them, okay, I sent you $500,000 and take 1% of that number and figure out a gift. And the gift is just as important. Now, here's my point, and don't get me wrong. It's not about the value of the gift. It should be impressive because they're a good referral, but it's not about the value. It's about the thought. For example, let me give you the ultimate example. My endodontist that I told you about, I was probably sending him on any given year $250,000. Every Christmas, I would get a can of peanuts from Costco. That's not even the funny part, Grant. I'm allergic to peanuts. I got a can of peanuts for 20 years from the okay? So here's what happened one Christmas. One Christmas, my wife comes in and substitutes for my front desk who was on leave. She sees the can of peanuts and she goes, "Who's this from?" "It's from Dr. So-and-so." She says, "He doesn't know you're allergic to peanuts?" And I go, "No, never thought about it." She calls the office up and she says, "Are you aware that Dr. Martel is allergic to peanuts?" And they went, "No." And she goes, "Have you ever asked?" No. This is my point. Part of a PRC, if I was a PRC and I had a really good referral, part of her job or his job when they walk into that referral's offices, I would look in their waiting room. Do they have a flat screen TV on their wall? If not, get them a flat screen. Here's the value of those types of gifts. And this is part of the book as well, but it's super important. I want to give them a gift that they're going to use over and over and over again, as opposed to a one-time use where it gets thrown away, right? Because if they look on the wall and they can put their own little promotional video on it, whatever they want to do, every time they walk in their own waiting room or reception room, they're going to say, "Oh, Dr. Stucki gave me that. It's really cool." Now, to give you an example for me is I had a periodontist that I sent all my work to. And when I would dress up, she would notice that I wore French cuff shirts. Well, what did she do one day? For Christmas one day, she went to Tiffany's and bought me a pair of silver, they weren't gold, they're silver cufflinks. Okay. But to be honest with you, every time I put those cufflinks on, I thought of my specialist. So those are the little things that make all the difference, because gifting is about the thought, not about and I'm sorry, this was my vision of my endodontist. He would pull up to Costco, he'd get one of those carts and put like 50 cans of peanuts in there, and he goes, "Great, I'm done shopping for Christmas." Okay, and here's the irony: I got the same gift as somebody that sent him $500 for the year. You see my point of the money there? That's the point of it. It wasn't because I expected something more expensive. I just knew that doesn't matter how good of a referral I was, everybody got treated the same. And you know what? That's not life, right? And even if it's like something Roger said, you take them to have a dinner out with the wife, great. Something I had a lot of times where I would, even with my specialist, I would call my specialist wife and says, "What type of scotch does Bill drink?" And I'd make sure I got them that, because or does he drink wine? Does he do this or her? And it became something like they realized that I had to think about it and make a little effort to get it done. And lastly, the book will tell you this, and I think this is super important. I think the most brilliant idea I got out of the book is gifting on odd days, not during Christmas. Just, let's say it's October, and it's your best referral. You just send them something. Because it's something that sticks out, because it's not when everybody else does it, and it's a different type of gift that's thoughtful. When you do that for people, that draws out an emotional thank you out of them, and they're always going to remember it. And that becomes a big part of your referral base, because you're going to be somebody that in their mind is a little bit more special than somebody else. That's all it really matters, is stand out more than the guy across the street from you.
For sure. Yeah, I love that point of maybe even doing some research, talking to the staff, figuring out what it is that the referring doctor values, what's important to them. and buying them a meaningful gift that's customized to them. That's a really cool thing. Well, this is helpful. Any other thoughts on how and why the GPs refer?
It's changed over time because I think the referral patterns, and you're probably more of a testament to that than I am at this point, is because I think we're seeing out there, GPs keeping a lot more in-house nowadays than probably in the days when I was doing a lot of this, and so even more so, people like Roger are more important because it's something that, and I think that the challenge is this: what Roger's teaching you and what I'm telling you is always has to be front of mind. But the problem with that is you're busy doing surgery, right? That's where the value of PRCs come in. And ultimately, even when you do education, it shouldn't be something that, and I know education for your referrals can get expensive. But to be honest with you, let's say, for example, and I get this with a lot of surgeons, Grant Stucki is doing something in Denver and Grant's going to be the speaker. Well, I don't want to hurt your feelings, Grant, but your referrals don't want to hear from you. In other words, they hear from you enough. They get it. Okay. They want to, that the old adage, a prophet isn't a prophet in his own hometown. They want somebody from out of town because it appears to be an expert, and maybe they're not. Okay. But ultimately what I do in my education is, if I was doing something with you, I may be speaking all day, but at lunch, you're going to speak for about 40 minutes and tell them about a new way to do wisdom teeth or this or that. So it's this constant. And here's the other thing, and Roger had a good point here, and I agree with him. A lot of times surgeons, whether you want to grow their practices through CEs and things like that, they do it a couple of times and then they kind of, well, it wasn't that great, so I'm going to quit. No, it's constant. It's over and over and over again. It's just like marketing. Marketing, you only notice that it's not working when you stop doing it, right? And then all of a sudden, maybe it didn't work after all. So you can't give up on it. You have to be different than everybody else, whether it's gifting, communication, education, and you have to do it like you've never done it before, all the time. And whether it's through, and I would say this, PRCs are important, but GPs like the personal touch of the person they have a relationship with. Your PRC is very important when it comes to a relationship with team members. But for example, if I'm calling your office, I want to speak to you. That's just the way it is.
Yeah.
And yes, you have that person in between, but I'm a good enough referral. Well, I don't need to speak to Kathy. I want to talk to you because I'm only calling when I know it's important. So ultimately, the goal should be just make sure that when they want to talk to Grant, they don't get filtered out through that. And that's something you guys have to work on with your team members at your office to make sure they're not filtering people out that you didn't even know it happened. And then they get a little bit triggered. And then all of a sudden the referrals are slowing down again. It's this, I hate to say it, but it's this constant babysitting of the relationship, because it needs attention. Because if it not, the next surgeon that comes down, builds an office across the street, all of a sudden, if they pay more attention to you, like Roger said, they're going to start going there, because maybe they don't have a relationship. And that's very frustrating. I get it. Not many people ended up being wired like me, where I found my group and I just stuck with them the whole time. But I think the more and more you invest in people, I think that can happen again.
Yeah. One other question was, does the GP want the surgeon to sell the case? How much does a GP want a surgeon to push and really sell it to the patient?
That's a great question. It depends on because there's probably three types of GPs out there. Number one, and here's the quandary as a surgeon you get into. The GP sends you a case, and and unfortunately, a lot of times the little slip or the phone call or the chart says evaluate for implants, for example. And that's got to be very frustrating for the surgeon, because here's the challenge you have. Let's say it's a full arch all on X case. Does the GP even understand how to do the case, right? So now you're caught between a rock and a hard place, because do I sell the case and knowing the GP doesn't know how to do it, and then maybe hurting their feelings or getting them upset, right? Or do you have to make that dreaded phone call? Hey, can I send it to the prosthodontist down the street because I know you don't know how to do this? That becomes a big, challenge, because it's, you don't want to offend anybody and you don't want to feel like you're taking business away from them. So that type of case, when the dentist really doesn't understand, however, maybe a more complex case, those are tough ones to sell for them, because you need to make sure where they're at. And that, again, goes back to education, to make sure maybe they need to be educated on how to do a case. Or maybe you get a lab involved with you, Grant, and you babysit through their first full arch for them. Not you personally, but you have the lab guy go to their office, even if it's maybe at your expense a little bit, and get them to the point where they're comfortable doing these cases. When those happen, you got to kind of play it by ear with every GP. For me, I was the extreme opposite. If you and I were talking, for the most part, and I'm selling an all-on-X case, I probably have it sold before I send it to you because I've already done hundreds of these. And I go, Grant, we're going to do this. She needs all her upper teeth out. I'm thinking about 6 implants. I told her it's going to be about this kind of price, barring any kind of sinus lifts and stuff, because maybe you and I have done a lot of cases, so I kind of know what you charge, and they're already ready to go. That's the other way, right? That's the extreme opposite side of that. And then you're going to have those middle guys that probably do want you to sell them for them, right? They know, and maybe it's, again, it goes back to the communication. And whether it's a text, and, we talked about, you can have HIPAA compliant text like Dr. Talk nowadays and things like that. But maybe you text the GP and say, do you want me to present an all-on-X case to this patient? Are you okay with that? And those kind of things can happen instantaneous, but you never want to step on their toes, and you never want to, over treatment plan for people. And you're going to hit that middle of the bell curve, where if you start selling for dentists that are adept at doing theirs, they're going to love you. They're going to be very loyal to you because you're making their life easier, which is super important. Make their life easier.
Oh, for sure. Yeah. Great point. I mean, it seems like a lot of that comes back to being able to communicate, especially maybe before the patient's sitting in your chair, because sometimes that's too late. You can't get a hold of them.
Right.
Really, go ahead.
My protocol was a little different because of these kind of things. And maybe it's because of the way my practice ran, because since it did run like a prosthetic office, my volume was a lot lower. I did bigger cases, it was low. So I did have the time where if I sent Mrs. Smith over to Grant, I would probably call you sometimes even before the patient left the chair or right after they left the office. And I go, hey, I'm sending Mrs. Smith over, and then I need to talk to you, and then we're going to talk about the case. So I'm going to review the case before you even got the case, so that you know where you're, what we're thinking about doing. Because ultimately, as you know as well as I do, if the restorative dentist and the surgeon are on the same page as far as the treatment plan, the patient's much more likely to accept treatment, right? Because they've heard it twice now.
Yes.
So that's why, in your case, you may need to, for some of your less experienced dentists, you may need to pick up the phone and say, what type of case do you think this is? Do you want me to present it? If it turns out to be a all-on-X case, do you want me to go in that direction? Are you comfortable with that? And that's, again, like you said, it's all communication, because the last thing you want to do is treatment plan somebody for a big case, and they won't admit it because they'll be a little embarrassed, and all of a sudden they get a little upset because they've never done a case like that. And trust me, because of what I do, I get a lot of emails from the attendees of the GPs around the country. And they say, I just got this case. Can you help me do it with you? Can you treatment plan it for me? Even if the surgeon's already seen it, because they don't want their surgeon to know that they don't know. And that's understandable, right? But somebody has to jump in for them.
Yeah, I absolutely love it when a GP will call me, contact me and say, hey, I'm sending this patient over. Here's their background. Here's their financial situation, their health situation. Here's the plan I'm envisioning. Can you work with me on this plan? It just, then the conversation with the patient is so smooth because we're all on the same page. I'm not introducing new treatments that are probably outside of their realm of being able to pay for or maybe even heal from a health standpoint, and confusing them, because a lot of these patients, like you're saying, the dentist has teed it up, has figured out with a lot of effort what the best plan is. And so I want to continue that conversation in a smooth manner.
Absolutely, because and like you said, it's so much more likely that the patient's going to be saying yes. Let me give an example. Let's say, and I did this on every patient. Let's say you're the patient and you're going to lose number 5. Okay, and everything else is fine. I'm going to say to them, patient, Mrs. Smith, you need to get this tooth out. We're going to put an implant here. Here's who you're going to. Not here's 3 cards. Here's who you're going to. And then the other thing I did, which was quite different, I never handed any patients a card ever. My front desk, the name was Dee Dee. I would say, Dee Dee's going to call Dr. Stucki's office right now and set up the appointment for you. Now, if the patient says to Dee Dee, I don't have my schedule, here's the next thing I say. We'll call you. Dee Dee will call you tomorrow when you have your calendar in front of you, and we'll set up the appointment for you. Now, the last thing I say before I leave the patient is this. Mrs. Smith, before you get there, I will have already talked to Dr. Stucki. I will have told him what you needed. He's going to know exactly what's going on. So when you get in his office, when you get there, everybody's going to be on the same page and know exactly what's going on. Now, how much more likely is that patient going to say yes? than let me hand you 3 cards and hope you go.
Right.
Right? I mean, it's just a whole different mindset because I always looked at dentistry as a service. How do I service this patient the best I can so that everything happens the best way possible and they feel like when they left my office, it's different than the guy down the street. And I've said that to you a few times tonight. I want you to be different, however that stands out. And it should always stand out, obviously. He did more than me. Now, think about this, Grant. If you do that with your GPs, what we just talked about, and no other surgeon in town does that, everybody by nature is going to refer to you because you make it easier for them. So part of increasing your referrals is, how do I make it easier for my referrals to refer to me? And I can tell you one that doesn't work. Dr. Stucki can't see your patient for until the end of August. You just lost me. The attitude is, we'll get you in within the next couple of days, whatever it happens to be for you. Even if it's going to take a little stress on you, the answer is, I have a friend up in New Hampshire. His answer to every one of his referrals is, come on over. We'll figure it out.
For sure. Yeah, that's a huge one. I'm glad you brought that up. I mean, that's my mentality as well, is let's get them in, figure it out, spend the hours, do what we can. You don't want as a surgeon to have maybe a front desk person who's maybe blocking patients, because unfortunately the reality is that a lot of the staff don't want to add patients. They want to get out of there sooner. And so they're motivated to push people off to different days. And I mean, so you got to figure out a way to make sure you're treating these people in a timely manner.
Well, and a lot of times, and I hate to say this, but it's almost a point of boasting when a surgeon tells me, "Oh, I'm booked out for 3 months." So let's say I'm having dinner with a surgeon like that, and when I start working with a surgeon, I'm going to be very honest and blunt with them because I really want them to understand the GP mindset. I would literally look them in the eyes and I would say this: if I called your office and you told me my patient can't get in for 3 months, I would find another surgeon. That's not something to brag about. Now, having said that, it's my responsibility as the GP. If Grant Stucki had this attitude of come on over, which is great, I'm also going to look at the patient and go like this: Mrs. Smith, he said you can come on over. You might have to wait a while, but he'll see you today. So they don't get upset by being in the waiting room. In other words, you lower their expectations. They're not going to see you immediately, but at minimum, they're going to see you today. I mean, that's a service that's so valuable. And here's the good news. You get to see a patient. You've just increased your production. The GP is going to get their implant or whatever it happens to be sooner. And here's the ultimate thing. If you make the GP look good to their patient, they're going to love you. If you ever make the GP look bad to their patient, you're going to lose them as a referral.
Good point. So important to get people in a timely manner, to be accessible, be available. I mean, that's all the stuff I'm hearing from you today is good communication, timely communication, getting people in, knowing what your dentist is looking for in their team, educating them. All this stuff is so valuable.
Think about this. Think about this little example. Let's say you still have a dentist that hands out 2 cards. Let's not use 3. If I'm going to refer somebody and I know I need to get this patient in more quickly than normal, and I know Grant takes somebody same day and the other guy might have to wait 3 weeks, who am I going to send it to? The other guy's name isn't going to even come up. He's going to go,
right,
send it here because I know Dr. Stucki is going to see them right away. And as soon as you keep that promise all the time and become very consistent with it, eventually they're just going to give up on the other person. I promise you that they will, because that's what I would do, because you're being very consistent. You're being very, you're helping them, accommodating, everything is working. And then eventually, if they're smart, they're going to come and go, they get treated differently at Dr. Stucki's than they do someplace else. Why would I send anyplace else? And that's a mindset. That takes a little time, but it works.
Yeah. The other thing too is I'm always available and open to seeing other surgeons, patients, post-op patients. I really don't turn anyone down because I'll get calls. Hey, would you mind seeing this implant? This other surgeon or periodontist put an implant in, and it's 2 weeks later, they're in horrible pain, but that person's out of town. Could you get them in and see them? And I'm always sure, let's get them in, especially if they're in pain. And I'm very complimentary. I don't throw anyone on the bus and say that this was a horrible job.
You're very accommodating, because that's being kind, because I could see both sides of that, and I get it. But you know what it is? What you're doing is so good, because you never know whether that other surgeon is going to retire someday, or maybe one little thing got them upset and now they're going to go start using you more often. So that accommodation is always putting another piece of gold in your pocket. And it's a sense of, you're just building rapport more and more and more. And ultimately, all I care about is, let me give you a really interesting example. I had this one surgeon that was doing my implants the first 10 years of my career. And just like I always tell you, I would only use one person at a time. That's just how I did it. And then that years ago, he switched to another implant company that I wasn't crazy about that implant company. It's all it was. So I decided to use my other surgeon more often. What happened was, here's the interesting part. I had such a habit of saying that surgeon's name because I referred to him for 10 years. To the patient, I'd go, need to go see Dr. I had to catch myself because it's constant using that same name all the time. So it took a little learning, but it just shows you how you can ingrain somebody into your practice and referral system because you're consistent and you're doing it all the time. Now, don't get me wrong. I wasn't being harsh. I told the surgeon, listen, I really don't like that system. Would you mind doing the other ones for me? And he said no, which was shocking to me. And so I had to switch surgeons because I wanted I used either Biomed or Straumann. That's what I wanted to keep on using. But the habit of doing that, I actually would catch myself saying the wrong name because I was such a habit of using the previous surgeon that it was an interesting, but ultimately it worked out. But it just showed you that humans, we're all creatures of habit. And if you create a habit in your GPs, they'll keep on doing it.
Yeah, so important. Well, Vic, thank you so much for running through these points. If you're good with it, I could put your contact information in the show notes so that listeners could reach out to you if there's further questions.
My pleasure.
Awesome. Thank you. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayOralSurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.